Hello, everybody. I'm Dr. Jaishree Sharad. Let's talk about teenage acne today. Now, acne is an inflammatory disorder of the pilosebaceous unit. What is the pilosebaceous unit? The hair follicle with its shaft and opening, which is nothing but the pore, and the oil gland or the sebaceous gland, which is attached to it. During teenage, the person has attained puberty, and there are a lot of hormonal changes that happen. These hormonal changes will stimulate the oil glands or the sebaceous glands to secrete more oil. Typically, in people who have a genetic predisposition or in people who have more number of sebaceous glands, this activity is more. Now, because of excessive oil secretion, there is a buildup of sebum. There are a lot of lipids and oils in that sebum. And this is food for the microorganisms called Cutibacterium acne, which are normally present in the oil glands. So when they multiply, one develops whiteheads and pustules. When these whiteheads get exposed to sunlight, they get oxidized and they become blackheads. When the entire pilosebaceous unit gets inflamed because of a lot of oil secretion and a lot of bacteria growing, it turns into a cyst or a painful nodule or a lump which is there beneath the skin. How do we treat this? First of all, we need to understand that this is a lifestyle disorder. So we do not give any kind of hormones at this age. Of course, once a female attains puberty, we wait for about 4 years for the HPA axis to become normal. And then we do investigate for PCOS if the acne are cystic and persistent. But in teenagers, first important thing is the diet. So they must be told to avoid junk food, to avoid food with high glycemic index, avoid sugars in all forms, chocolates, ice creams, cakes, pastries, because sugar raises the hormone called IGF-1, which will again stimulate this entire vicious cycle of acne formation. Dairy will increase the IGF-1. So also advise the kids to avoid dairy. And then, of course, it's important to sleep on time. It's important to stress less because stress will again cause the hormones to go haywire. Following the circadian rhythm, sleeping by 10:30, 11 p.m. is extremely important. Exercising at least 4 times in a week, maintaining your body weight, seeing that your BMI doesn't go above 24, 25. All these are very important aspects of controlling your acne. Then, of course, wash your face at least once or twice a day with a salicylic acid-based face wash. Salicylic acid is lipophilic. It will dissolve the oils and help to unclog the pores. Make sure you do not over-scrub and exfoliate too much and don't wash your face throughout the day because that will damage the lipid barrier layer of the skin, and that too is harmful for the skin. Use a water-based moisturizer or a gel-based moisturizer. Similarly, before stepping outdoors, make sure you use a water-based or a gel-based sunscreen. Now at bedtime, you can use a 2.5% benzoyl peroxide on the acne, but make sure you use very little quantity. Application of too much of benzoyl peroxide or even a retinol can cause a lot of dryness. If there are pustules, of course, a clindamycin gel will help. And then supplements like omega-3 fatty acid, vitamin C, inositol do help, especially in females if they are headed towards PCOS. It's also important to see if you have any dandruff and use a 2% ketoconazole-based shampoo to avoid acne on the forehead. Most importantly, make sure you do not touch or squeeze your acne because when you pick at them, you not only increase the inflammation and the infection, you also end up with a lot of scars and blemishes. And of course, it's important to consult with a dermatologist because the dermatologist will be able to guide you the right way. And sometimes you may need oral medication as well, and that you cannot do on your own.
Subscribe to the YouTube channel and don't forget to hit the bell icon so that you don't miss any videos by us.